Imagine being a 21-year-old female with multiple altering personalities, and you never know when they're going to switch. This is a real disorder and is known as dissociative identity disorder. A person with dissociative identity disorder, known in the past as multiple personality disorder, develops two or more distinct personalities, often called subpersonalities or alternate personalities, each with a unique set of memories, behaviors, thoughts, and emotions. At any given time, one of the subpersonalities takes center stage and dominates the person's functioning. Causes of these include traumatic events, an extreme form of repressing memories. Usually one subpersonality, called the primary or host personality, appears more often than the others. The transition from one subpersonality to another, called switching, is usually sudden and may be dramatic. Switching is usually triggered by a stressful event, although clinicians can also bring about the change with hypnotic suggestions. The subpersonalities may differ in features as basic as age, gender, race, and family history. Investigators used to believe that most cases of dissociative identity disorder involve 2 or 3 subpersonalities. Studies now suggest, however, that the average number of subpersonalities per patient is much higher, 15 for women and 8 for men. In fact, there have been many cases in which 100 or more subpersonalities were observed. Often the subpersonalities emerge in groups of 2 or 3 at a time.
Meet Vanessa. Vanessa is 21 years old and is struggling with dissociative identity disorder, a disorder that affects her everyday life.
This is my friend Vanessa. Hey Vanessa!
Hey Danielle,
How have you been?
I'm good. How are you? You got an A? Are you serious? We both studied together. You're such a loser. I don't like you. Get away from me. I'm so much smarter than you. I don't like you. Oh my gosh. This isn't my cereal. Who did that? Why is this not even folded? Oh my goodness.
Hey Vanessa, what happened?
Hey.
What happened?
I don't know.
Stuff all over the floor.
Where'd all this cereal come from? Were you eating earlier?
I wasn't eating. I just got here.
Oh, I don't know. I don't know how this got here. Wow. This is all this food. I'm just wasting food. Wow. No.
You're the only one here.
No, I just remember I was pouring cereal. Oh wow, I probably did this. I didn't even know. I don't remember.
Interaction of subpersonalities. There are 3 kinds of subpersonality relationships: mutually amnesic relationships, mutually cognition patterns, and one-way amnesic relationships. In mutually amnesic relationships, the subpersonalities have no awareness for one another. Conversely, in mutually cognition patterns, each subpersonality is well aware of the rest. They may hear one another's voices and even talk among themselves. Some are on good terms while others do not get along at all. In one-way amnesic relationships, the most common relationship pattern, some subpersonalities are aware of the others, but the awareness is not mutual.
Would you like to talk more about that?
Yeah, I've started to notice lately that I've been feeling different. And I feel like I have a type of disorder where it's like I keep switching constantly, and I don't. I know. I just feel like I need help, and I don't know how to fix it.
Well, have you ever seen another doctor? Never?
No.
This is your
I
second
like your
time?
dress.
You like my dress?
Yeah.
Does your daughter have a dress like this?
How do you know I have a daughter? I don't know. I don't know. I need help, but
You need help.
I don't know what to do. I take
Why would you like me to
medication?
help you?
Am I supposed to take a pill? I see people take pills. I don't know.
Treatment for dissociative identity disorder. A cognitive behavioral therapy approach is often recommended that incorporates communicating effectively with the alters and helping the patient find more adaptive coping strategies than switching when distressed. This can be enhanced by treating relaxation exercises, suggesting breaks from the setting for a few minutes, and helping the patient gain control over cognitive distortions over the self and world. Other techniques in treatment include clinical hypnosis and eye movement desensitization reprocessing, or EMDR. Antidepressant or anti-anxiety drugs can also be used to help manage associative symptoms. To learn more, we asked a professional about her experience in treating patients with DID.
People can have a dissociation disorder, identity disorder, and maybe have a mild case of it or a more severe case of it, depending on the individual and what they've gone through. But generally it's brought on by trauma, something they've experienced like neglect, abuse as a child, a rape, could be war that they've experienced. And it's the brain's way of protecting a person. They can have anxiety, depression, their emotions can be extreme. Many times anything that reminds their subconscious brain of the tragedy or the trauma they experienced as a child could be a smell that will trigger them to go right back into that other personality or that imagination, and then they're safe. They don't have to experience what's going on at the present moment. A lot of times I use more of an eclectic type counseling with these individuals based on what their needs are. One technique, EMDR, is what I use, and that's for post-traumatic stress disorder, and that helps the person be able to deal with what happened and let their brain know that they're safe. And then the brain is able to process that event, break it down, file it away to where it's supposed to be. You still remember the event, it just doesn't bring the trauma with it or the disturbance or the pain. And so I'll use a variety of those type of techniques. But when they come in, my goal for them is to help them feel safe and to trust that they can trust themselves. They've got to feel safe in order to experience pain, in order to stay with it. And that's the goal. I think society needs to become more educated on what mental illness looks like and what causes it. We fear anything we don't understand. So these people need respect, they need relationships, they need appreciation, just like someone who's not mentally ill.
For more information or support for you or someone you know with DID, you can visit the websites of or contact the following organizations or similar organizations: